Welcome. My name is Jennifer New, and I'm the Associate Director of the Obermann Center for Advanced Studies at the University of Iowa. And this series, Obermann Conversations, is a program that we run to put some of the scholars that we work with in conversation with people in the community around shared areas of expertise. And this is our first conversation of this academic year, so welcome. Tonight we are talking about school and mental health and the role that schools play in responding to mental health needs and the ways that kids are also experiencing mental health and their own issues within that space. So we'll be talking about kind of school from different angles. We're hearing tonight from 4 different speakers. Allison Bruhn is Executive Director of the University of Iowa's relatively newly established Scanlon Center for School Mental Health. And Lindsey Schluckebier is the Curriculum Coordinator in the Iowa City Community School District for K-12 Counseling and Health. And Maithreyi Gopalan is Assistant Professor of Education and Public Policy at Penn State University. And Shannon Lea Watkins is Assistant Professor of Community and Behavioral Health at the University of Iowa. And those last 2 speakers who I just mentioned were with the Obermann Center this summer via one of our grants, and we're working together. So if I sometimes seem to be asking them something as a single unit, that is why. So just to kind of paint a little bit of a picture going directly off of some of the numbers and information that is on the Scanlon Center for School Mental Health's website. So 1 in 13 Iowa high school students have attempted suicide 1 or more times. And suicide is the 2nd leading cause of death for Iowans age 14 to 44. So this is certainly an extremely serious and sobering topic, and one that we want to really discuss with care for the kids who are affected, for the teachers in the building and the educators, and also I think also the care that the researchers take in doing their work around this subject. As we planned for this conversation, everybody here was really curious in knowing more about who is in the audience and what's bringing you tonight. And so because this is a webinar style and we're not using chat, if you could use the Q&A function to just tell us a little bit about yourself, if you're a parent, if you're an educator, if you're a student, and what in particular is bringing you to this conversation this evening. That will help us to better figure out the approach to our answers and our questions. So I wanted to start with Allison. And Allison, if you could talk a little about the role of school in this, what I think can fairly be called a health epidemic. So how, a lot of us went to school at a time when mental health was not really part of the services that we were able to access, and it wasn't necessarily something that we were accustomed to discussing in the school. So what is emerging right now as the role of school with mental health?
I think it's first really important to define what is school mental health. And we define it as the social, emotional, behavioral, and psychological well-being that allows the students to be successful in schools. And, traditionally we've thought of schools as academic institutions. But I would say over the last 20 or 30 years, there has been a pretty strong recognition that mental health, so social, emotional, behavioral, psychological well-being, has an impact on how students perform in school. So those things go hand in hand. So how we approach it in schools is critical, particularly given the amount of time that our students spend in school. So we often talk about teachers being first line responders. I'm a former teacher. I'm in a teacher education program. And so we don't train our teachers to be mental health providers, but we do train our teachers to manage their classrooms effectively, because we know that students need safe, supportive, organized, structured, predictable environments in order to feel safe, in order to feel like they belong. We teach our teachers to build relationships with students that will support their mental health. And so I guess the other piece that I would say is that the majority of mental health services, at least for kids who have been identified with like an emotional and behavioral disorder, are provided in schools, but that is also so very little. So I think the numbers are like 20% of kids actually get services in schools. And that number is abysmal, really. But it's also hard on schools to think about how they expand to provide the supports that they need while still being able to focus on their academic mission. So there is, I understand the tension there, but I think Lindsey will probably talk about this as well, is that we have frameworks and we have evidence-based practices that we know work in schools to support kids' mental health.
And thank you, Allison. Lindsey, can you talk a little bit about what you're seeing kind of on the ground in the schools here in our community, both in terms of what kids are sharing, and then also what teachers are maybe both experienced in the classroom, and then what they're wanting in terms of support and training and so on?
Absolutely. And I appreciate, Allison, everything that you said about the role that schools play in mental health and just overall well-being of students, right? And we know that schools have been in the business of supporting the whole child for a long time. And we know that we continue to need to improve in that area and learn and grow in that area. So I would say, especially as we're coming out of COVID and as we see some of the impact of COVID, some of the needs of students that have seemingly risen are certainly anxiety. We're seeing a lot of anxiety in our students, and or anxiousness. I wouldn't, not like diagnosable anxiety, I don't mean that, but just general anxiousness. Certainly a need for or a lack of developed social awareness and relationship skills because of the time away from schools and those times of being disconnected. And also I would say the elementary school, a lot of things I'm hearing from my school counselors in particular are the need to work with students on executive functioning skills. So flexibility, organizational skills, emotion regulation, and ability to get along with others. So those are areas that we're seeing a need for greater support. And I would say that aligns perfectly with what teachers are wanting. They're wanting support with, how do I keep kids engaged? How do I get them to be able to work effectively with one another and to be able to talk about problems when they're having them and ask for help? So those are all areas that we're trying to provide professional learning and supports around. Last year, our district did district-wide training from the social, emotional, behavioral health team. And that was around what's called 6 effective classroom practices, which is an evidence-based, those are evidence-based, easy to implement practices based in positive behavior intervention supports, and really spent a lot of time building out what that looks like, how teachers can implement those into the classroom to create those safe and supportive and orderly and predictable environments that Allison referenced. And we know it has to start there. We can't just respond to crisis situations. We have to provide those universal supports for each and every child that walks into our buildings.
Can you say a bit about what those are, the 6?
Yes, I'm going to look at my notes just so I make sure I don't forget. Don't forget any.
I didn't mean it as a test in any way, just so that people have a sense of what kinds of things are being shared with the educators.
Yes, absolutely. And of course, I actually didn't write them in my notes, so it's going to really, Allison, you're going to have to help me if I forget.
I actually have the document up.
Do you? Perfect.
Yeah,
I'll let you take that one then. Thank you.
So is it the arrange orderly,
Yes.
like the physical arrangement, making sure that the classroom is arranged in an orderly way so that students can, move around in ways that don't cause issues. I mean, that's really related to just the overall setup of the classroom. Establishing clear expectations, routines, and procedures, which is probably, in my opinion, the most important one, that students know what's expected of them in every single classroom at all times of the day. And they are taught those things. So we don't just expect kids to know what to do when they come to school. And, sometimes we talk about this, we get pushback from maybe middle school or high school, like they should already know how to do this. Well, yes, they should, but they're not doing it. So we teach them the right way to do it. And then we actively supervise, we provide feedback, we encourage students to do the right thing, to meet those expectations, to follow the rules, and to ask for help when they need it. And then another practice that is on here is a continuum of responses to inappropriate behavior. So it's really imperative that schools have systems in place that clearly define what behaviors would warrant, something more than just, the teacher talking to them and trying to correct the behavior. But that also has to be laid out and very clear. So when there aren't systems and it's haphazard, then it's constantly putting out fires and you create an environment that is not predictable, it's not safe. And that can also be really hard on teachers. And then one of the other, or the last practice that is on this is using a variety of strategies to get students engaged in class and providing high opportunities to respond. So for those of you who are not educators, what that really means is that when a teacher is providing instruction, that teacher is offering different ways that the students can basically respond or provide answers or get involved in discussion multiple times throughout the instruction. So it's not, they're just not just sitting there listening, they're actually doing and engaged. Because if they're engaged and they have those opportunities, then they're less likely to be doing something that they're not supposed to be doing, whether that's behaviorally or if sometimes it's withdrawing. So our kids that have really high internalizing behaviors, if they're not engaged, that can also manifest in, some somatic complaints or some anxiety or, just total withdrawal.
And a piece that was woven throughout that series of professional development for our teachers was relationship building, because that is foundational. Even if you do the best job creating an orderly environment and giving feedback, if the students don't feel like they have a relationship with you and trust you, then those things aren't going to matter. So we spent a lot of time talking about ways to build authentic relationships to help students feel safe and to engage in that higher levels of learning.
Mm-hmm. Mm-hmm. And so it's interesting, and this is, I'd love to bring Shannon and Maithreyi in, because so much of what you were both just talking about, Allison and Lindsey, is very much in the classroom, which totally makes sense. And yet school is so much more than just the classroom. And of course, during the pandemic, many of us heard from kids that a lot of what they were really missing was all the other stuff. So I would love to hear from you two just a little bit about your research project, just to help us kind of better understand, and then how you think of school as this sort of ecological space. And yeah, and we can just kind of go from there. That'd be great.
Sounds good. I can start off, and Shannon, feel free to jump in anytime. I think both Shannon and I come from slightly different perspectives, both in terms of research, given our training in public policy. So we ask from the perspective of what is the policy context that shapes school environments for being good places where mental health can be centered versus not. And I think we also try and bring in a more longer term perspective into thinking about what happens in the school context in terms of mental health and what effect that might have on much longer term, later life outcomes in terms of their health, because we know that 3/4 of all mental health disorders has its root in adolescence. So much happens in adolescence, and schools really set the stage for what happens in terms of the mental health trajectory going forward. And so I was just really excited to hear about Allison and Lindsey's take on what is happening in the class, because that classroom context really sets this frame for how students perceive the school context, and that perception really seems to have an impact on not just their outcomes in terms of depression and anxiety in schools, but 20 years after. And that's the kind of work that we're trying to build on right now, is to think about how when students perceive their sense of connectedness with their classroom, with their peers, when they have strong teacher relationships, this whole gestalt of feeling safe that Allison and Lindsey were really describing really well, seems to build on this idea that school context really seems to matter. And it matters not just in the present, but also as we go further along. And we are beginning to tease that idea of what the school contexts are and the specific relationships, both at the school level, but also the neighborhood level, and the policy context that defines these, that kind of translates into students' mental health outcomes. Shannon, do you want to add something?
Sure. Thanks, Maithreyi. So I am reflecting on what's already been shared. And one of the exciting things I'll just share about working with Maithreyi is that we are combining, like, my background in environmental justice and neighborhoods, and thinking about the neighborhoods in which kids are growing up as a huge factor that shapes their health and well-being, and Maithreyi's expertise in schools, and figuring out where the scientific literature is not speaking to each other, even though we really know on the ground that students are moving throughout all of these different spaces. So that has been really fun. When I think about school context, I also am bringing in schools as like a physical exposure route. So clean water in schools, buildings that are free of toxins, like all of this kind of physical stuff that can impact mental health. And I mostly study substance use among young people, adolescents, and through young adults. And we know that school is a place where kids connect over using e-cigarettes or tobacco. And we know that there's a relationship between mental health and substance use. So that seems to be working both directions. So schools also play a role as a potential place to intervene on health behaviors that can both come from poor mental health and then also contribute to exacerbating mental health. So I guess in our conceptualization is that there's the sort of mental health specific work that we call mental health work. And then there is also all of the other sort of work that relates to mental health, but we might not sort of call it health policy or mental health programming. And so what Maithreyi and I are doing is trying to combine school context and neighborhood context, and see if we can tease out some specifics about what's going on in schools when folks are young, that really helps us understand how our mental health when we are young contributes to our mental health when we are older.
And think I'm remembering correctly that you've looked somewhat at evidence on the effects of mental health issues when you're young on overall health effects when you're older. And can some of that was a surprise to me. If you could just tell us about that.
Sure. Yeah. What we basically find is that we have this amazing data set that basically tracks students over their entire adolescence to young adulthood to their adult health outcomes. They're basically adolescents who were in high school in 94 or 95. Who are now between 32 to 40 years old. And there are basically 5 waves of data where the huge rich data set, which looks at health behaviors across these different waves. And what we are basically finding, it's building on prior work. We're not the first ones to kind of examine this, but what we basically find is that students who reported high levels of depression, kind of stemming from this internalizing issues that Allison was talking about earlier, when they report higher levels of depressive symptoms when they were in high school, they also seem to have pretty high levels of overall negative well-being when they're 40 years old. While it might seem like it's not intuitive, we are basically able to control for a whole bunch of factors that happens before the reported depressive symptoms and a bunch of other contextual factors that might make some of these depressive symptoms worsen over time. And we find that the adolescent mental health reports, the depressive symptoms seems to have an effect on how they perceive their overall well-being and self-rated health, which is a marker that we use when they're about 40 years old. And we are also trying to figure out how some school contexts might exacerbate this relationship and how some protective factors, like when students are in schools where they feel supported, when they feel like they belong, for them, those depressive symptoms, especially low-grade depressive symptoms, don't translate to negative well-being later on in life. So that's the kind of moderation we are seeing in some of our very preliminary work that we were thankful that the Obermann Center funded in the summer. I'll stop there again because it's probably a bunch of other questions. And Shannon, if you want to add to that, feel free to do that too.
Actually, just given the kind of research angle of what you're talking about, it would be wonderful, I think, Allison, if you could tell us a little bit more about the various kind of aims of your center. And I know one of those is especially research. So just help us better understand what that center is doing.
Sure. So our center was established in June of last year with a $20 million grant from the state through federal COVID relief funds. And the charge of the center is really to improve school mental health outcomes for students and educators. And we're doing that through really what we are calling arms of the center. So we have a professional development arm in which we provide in-person professional development, online professional development. We offer webinars. We're actually putting on a big summit. If anybody would like to come, it is October 10th and 11th in Des Moines. And that is, last year we had 1,600 people there. So it's a big event for people in this space. So educators, counselors, school psychologists, administrators. And then we also do really individualized professional development and coaching for schools. If we'll go in and do some kind of assessment to figure out what their needs are, what their priorities are, and then design sort of customized learning opportunities for them that address those needs. We also have a research arm. And so the first year of the center, we really focused on actually giving money away for people to do research. So we have over 20 affiliated faculty. We also hosted a large competition across the state, and we gave away 4 $250,000 awards for 2 years for people to, or teams of interdisciplinary researchers to do intervention research in schools. And so we gave that 2 teams from Iowa State, 1 team from UNI, and 1 team from Iowa. And then we're also conducting our own research on practices. So we have a couple different projects going on. One thing we worked with Lindsey in doing some evaluation of, what was going on in Iowa City schools in terms of the counseling program and SEL programming, and what, parents and students and teachers and administrators had to say about that. We're piloting some different interventions in schools right now that are technology based, collecting data on that. And then, so we have a lot of things going on there. We also are focused on, one of our charges is to increase workforce capacity. So one thing that you'll see is that for schools, they're severely understaffed, and particularly for addressing this issue. So I think the recommended ratio of students to school counselors is like 1 to 250, which still seems like crazy to me. And I think in Iowa, I think our numbers, Lindsey, correct me if I'm wrong, I think it's like 1 to 400 or something. And so we're like way over. And it's the same thing for school psychologists. So we want to build the workforce in the state of Iowa. And so that's one thing that our center is focused on by, providing scholarships, but with those scholarships, providing really innovative training opportunities for those students who we hope will stay in the state and, become school mental health providers. And then we recently opened a clinic, actually this fall, to provide some crisis response and short-term intervention and assessment services for kids who maybe can't get in elsewhere, don't have the means. But then the long-term goal is to refer them out to community providers. And so we've been really active in that area over the last year in responding when, there's been a tragedy at a school and schools needed sort of longer term services on site. So we've gone in there and, done small group intervention and one-on-one sort of things for students who are in crisis. So that's the short.
Yeah. Are you located in the Lindquist Center in the College of Education?
We are, but we also, the clinic's physical location is Plaza Center 1 on the Penn Mall. The rest of us are in the Lindquist Center. So yeah. And then, the clinic, we're charged with serving the whole state. So a lot of what we do is telehealth because, we can maybe get kids from Iowa City and Cedar Rapids and, whatever, but people in Omaha or Council Bluffs aren't going to drive over here.
Right.
So and then I want to say one more thing, that we have also a higher education wing. We received a $700,000 P3 grant to do some additional higher ed programming for faculty and staff around mental health. And so Barry Schreier is heading that up. So we're excited about building that portfolio as well.
Mm-hmm. Yeah, and I should say that we're really focusing tonight on K-12, but this is certainly very much an issue in higher ed as well.
Yep.
Including those numbers of how many mental health professionals there are per student. Lindsey, to help give a better sense of that for people who are listening, like if maybe focusing on elementary schools, so there is probably usually 1 counselor per elementary school?
Unfortunately, we do not have 1 full-time at every building. So we have 21 elementary schools, physical buildings, plus the online learning program. And we have a counselor at every building and the online program, but not everybody is full-time. And then we have some buildings that are so large that because our elementary counselors do go into the classroom every week to teach a social emotional learning lesson, that those buildings that are so large, so Weber is the big outlier. Weber Elementary has 27 sections. And so there's more than 1 full-time counselor there. but then other buildings, smaller buildings. I will use Hills for the example because Hills is very small. Hills counselor also spends 2 days at Weber, and so she's only at Hills 3 days. And yes, Hills is small, but they are, every building could absolutely use a full-time counselor, and unfortunately, we do not have that currently.
And so how, I think as we're talking about this, you've been in this field for around a decade. And so how have you seen it change in terms of the work of counselors, the expectations, what they're responding to?
Yeah, I mean, it's changing all the time, just as it's changing for all educators, and really focusing on our programs mirroring what our national model, so the American School Counseling Association, ASCA, says is best practice. And that's really a comprehensive school counseling program. They do recommend one counselor for every 250 students in order to have what truly is a comprehensive school counseling program that every student has access to. And so that means that K-12, our counselors should be able to interact with and provide services to every single student in their building. And as you can imagine, when we get upwards of 1 to 450 to 500 students, that's just not possible. And so while that is true, we're still trying to build the capacity of our school counselors to really focus on those universal supports and to do so through systems and data. So I would say that's our biggest push right now as a program in Iowa City Schools, is looking at data to inform services and not just do what's lovingly called drive-by guidance, which means just whatever walks through our door. And I do a lot of we and our because I do come from the school counseling. I have that school counseling background before I was in this leadership role. And so really being intentional with the services that we're providing, and helping teachers provide that social emotional learning and infuse that social emotional wellness, behavioral health aspect into their classrooms every day. And then counselors responding to those students and providing skill instruction and support in those areas where kids maybe need a little bit more.
And just if anybody's listening who doesn't know what social emotional learning is, can you give us a quick?
Yes, absolutely. So social emotional learning is really the attitudes, skills, knowledge that individuals, not just kids, but children, young adults need in order to be successful, in order to thrive. And so there are what are called competencies, social emotional learning competencies. And there are 5, and that's self-awareness, social awareness, relationship skills, responsible decision-making, and I always forget the 5th one, and self-management. And so within each of those, there are areas. So for example, self-awareness includes accurate self-perception, identifying emotions. So there's a span of what that might look like developmentally across, again, preschool to adulthood. And we know that it's ever evolving, and that students, what might be a typical developmental stage for, let's say, a 7th grader right now might actually be, we might be a little bit behind again because of COVID and just that lack of connection that we all experienced over the last 2.5 years. So, but really what I also love about social emotional learning is it's the skills that our kids need to be future ready, right? When we think about what employers are looking for, those employability skills, they're those social emotional learning skills. So I know sometimes SEL gets a bad rap. People think of it as like, that's not the school's job. I'm sending my kids to school to learn the academic content. And as Allison mentioned earlier, they can't get that academic content if they're not feeling safe, if they don't know how to be in relationship with others, if they don't know how to navigate themselves and ask for help when they need it, and so on and so on. So those skills are just foundational for being in a community and for living, existing as humans. So important.
I'm curious, one thing, Shannon, that you talked about, and this seems also related to Allison's work. So I'm thinking here on our campus, you're in the College of Public Health on one side of the river, and Allison's in the College of Education on the other side of the river. And so you've talked about mental health being very siloed, and kind of a hope to shift that. And so I'd just love for you to share some of that with us.
Sure, thanks. I think what I meant to say is that there's an opportunity to integrate the way we think about young people growing up in neighborhoods and young people growing up in schools. And there's an opportunity for those two fields of research to talk. But it is interesting. So my training, as Maithreyi sort of alluded to, is in public policy. Now I am a professor of public health. And it is sort of interesting in Iowa City too, that we have this physical river that separates sort of the biomedical and the social science. And as in the social science department in the field of public health, which has roots in biomedical medicine and also social science. It is interesting that there's so much interesting work going on in town and on campus, and how do we make sure that we are seeing that we have one-on-one counseling and support for a student, and then also are embedding hear of the great work that Allison and Lindsey are talking about embedding that into the system. So hopefully, if we are preventing the sort of cascade of negative mental health outcomes, we need ultimately less of the one-on-one counseling, which of course is important because we're addressing it at a systems level.
Yeah, Allison, do you have any other thoughts on just how currently you're seeing mental health, especially in kids and around school, become being shared across various parts of research, various systems, and so on? I'm thinking, for example, talking to a friend who's a pediatrician probably 6 months ago, and she said that so much of her caseload was dealing with kids and anxiety. And she's like, I think now, I mean, she's probably in her 50s, but she's like, I think I probably had 2 days of training on that. And that's what I'm doing right now, is I'm not doing stitches on the kid who scraped, whatever. So just what are the different ways that you're seeing this issue get unsiloed?
Yeah, I mean, I definitely think that's a challenge. I do think, if I can brag about our center a little bit, that's one of the cool things to come out of our center is that when I look at just our directors, my background is in special education. Or I have another director whose background is also special education, but was an elementary teacher and a librarian, and studies educator wellness. Our clinical director is a counseling psychologist. Our research director is a clinical mental health counselor and school counselor. And then we have partnered with over 20 affiliated faculty across the university. So we have people in public health. Actually, we have a great research project that is being led by a professor in public health, Ebony Johnson. And yeah, we love her. You can clap for her. So she is leading a project really looking at improving mental health awareness amongst families, communities, and schools. And so it's been great to partner in that way. We have people in nursing and neuroscience. And so just having the opportunity to bring people together to solve these problems is great. I mean, that's one of the benefits of working at a university. I mean, there's just so many opportunities in that way. And, obviously I sound excited about it, but it's also hard, and because we come at it from such different perspectives. So I sat on we did like one of those ideas labs. It was mental health ideas labs, and a lot of people from the hard sciences, and there were only a few of us from, social sciences. So just a different way of looking at things and, figuring out what problems we think are important to study. But the only way that you can get there is to actually do it. So, having the chance to collaborate with others it's been fantastic.
So
I'm not sure I even answered your
no,
question.
you did. No, you did. I think that's great, and it's really wonderful to hear just kind of the cross representation going on with that center, and also that it's statewide, and that you're finding ways to work with Iowa State and UNI. That's really exciting as well. I have just kind of a final broad question. So I'd love it if people in the audience have questions to please put them into the Q&A. And then if any of you have questions for each other. But I think that you're all in great positions to be seeing exciting things that are going on in either this community, other parts of the country, or even other parts of the world. So any examples that you're seeing that you just think are really, hopeful, heartening, exciting, that you can share with our audience around schools and mental health? Anybody?
I'm happy to start. I would say that for me, as somebody who has been in the business of social emotional behavioral health for quite a long time now, it is exciting to see kind of the broader community paying attention to not just mental health, but overall student wellness, and understanding the importance of it, and getting on board with it. I would say, just the sheer amount of money being given to, the Scanlon Center for School Mental Health shows that people see the value in this work and see how important it is. And on the ground, I'm really excited about the systems level work that we're doing around social emotional behavioral health, and really looking at universal social emotional learning for all of our students, and building the capacity of all of our educators to support student wellness and belonging, and safe and collaborative environments. We continue to learn and grow and do better, and it's very exciting to see. One thing is we put in place this year, our secondary students on their student ID badges have a QR code that leads them to a website. Our district website leads them to a page that just says need support, and it has community resources. It has 988, suicide prevention, national suicide hotline. It has just some mindfulness components to it. So it's just a one-stop shop for lots of different resources, and in a way that students can easily access it and aligns with how they access information right now. We've already heard from students who are really appreciative of having that there, and we're continuing to try to figure out how to talk to students about what they need and how we can respond to that. And the last thing I will say is just this conversation, how all of these different areas are working toward the goal of supporting overall wellness for students, right? We're talking K-12, but for all of our, all individuals in our communities. And we can't do it in silos, right? We have to collaborate. And so that's something that is really exciting to me, is just there's more and more collaboration happening. We're continuing to expand our partnerships with the university, with different agencies in our community. And so I think that's the only way we're going to continue to build positive mental health systems and supports.
I think I would just add that while we've talked a lot about K-12 students, that we can't neglect the people that are serving them. And so, I'm a former teacher, so I would just say teaching is a hard job. And it's not just teaching, it's, you know, being a counselor, being an administrator. And I feel like we cannot neglect those people. I mean, the pressure that has been put on leadership over the last couple of years because of COVID, administrators, counselors, teachers, to, you know, be everything, everywhere, all the time for kids it's an enormous amount of pressure. And, you know, they also take the brunt of a lot of criticism in the media. And so if the adults that are serving the kids are also not well, we can't expect the kids to be well. And so that is one of the things that we're also focused on this year in our center is educator wellness, and how we can really help our educators to have better social, emotional, behavioral, spiritual, occupational, financial health. It's a little more encompassing than what we do for our students, but we can't neglect them.
And out of curiosity, what reception are you getting from educators for that work?
It's been fantastic. I think it's, you know, I can think of, we did a training this summer before school started for all the elementary schools in a district on the eastern side of the state. And I think they were just so excited to hear somebody validate, you know, the things that they were feeling, and to say, for us to go in there and say, you know what, you matter, your wellness matters, and we care about you. And here are some things that, you know, some tips, some strategies that might help you be well. Now, we don't have a silver bullet. If we did, we, you know, wouldn't need the state to give us money, right? So, but I think the reception has been overwhelmingly positive. We've had a huge turnout on our webinars that we've hosted last year, and we're expecting the same thing this year. So very happy with that.
I appreciate that so much, Allison, and reflecting that most of the folks that are joining us here are doing this in their quote unquote off time and in investing time. And so, Jennifer, you asked like what is inspiring and exciting. And I was talking about like really systematic changes, which are so important. And yet so many people are scrambling to like make this work when it's not built into the system to value it. So I mean, I'm coming to this conversation as a researcher and also as an educator of undergraduate and graduate students who have lived through the pandemic, and as a person who has diagnosed anxiety disorder and lived through the pandemic. And so it's like, all of those things are together in the people that are it is all of us, I think, in that experience. And I have found like gifts from the students who have connected with me as a person, and then them putting time in, and like everybody in this community to try to figure out how do we make changes in our lives or in our classroom within structures that are potentially not supportive of it, while we're also pushing to build school structures that make space for it. So anyway, I'm just really appreciative to be here with you, Lindsey and Allison. I mean, I love you, Maithreyi, too, but it's really a great opportunity to hear about the work that you're doing.
I just think that's such an important point, because even though we talk about like educator wellness and, these different tips and strategies that we can do, we also on our team often talk about how these are people working within systems, and until we change systems to value the people and have policies in place that are supportive of the people working in them, that the little tips and strategies are in some respects a band-aid.
Yeah.
Right.
Yeah.
Yeah, the only thing I wanted to add, just great points from everybody. The thing I wanted to add as the non-Iowa resident is that this is happening across the country as well. Very many states have now invested in specific children's behavioral health. And like Lindsey mentioned, I mean, I guess Lindsey, Allison, and I, and other people, researchers have been screaming about the need for mental health being a focus of schools has been forever high, but then I think the rest of the world, including policymakers at both the state and federal level, are really focusing on that now. And I think this moment is really an opportunity to kind of capitalize on that. And this is not just from the states and the federal level, but also like the National Institutes of Health. The number of RFPs that's opened up to focus on structural factors that is driving behavioral health has been skyrocketed over the last 2 years, and I think that you're going to see that continuing. And there again, there is this need for breaking down the silos. So we are taking a cells to society approach, and mental health is a classic example of how there are causes of mental health disorders that's biological, but psychosocial and structural. And so this is really a space where the silos can be broken down. And I think finally people are paying attention to it, and we should really capitalize on that, both in terms of research, but also providing the supports and designing the supports and interventions in a way such that we figure out what works and for whom and in what context. And I think that's where research is moving forward. So that is exciting.
There is one question in the Q&A that I think Shannon or Maithreyi, you may have already answered. So if one of you could go in and maybe type the answer, it's the last one. And please, again, if there are other questions, go ahead and put those in. And if any of you have questions for each other. We've kind of like danced around this, but it seems that this is one of those issues where the pandemic was exacerbated what was already going on and actually forced it to get addressed. Is that, I mean, Allison, you're nodding your head.
Yeah, I think the data support that from what I have seen come out in terms of like increased rates of various things. So increased rates of anxiety, of aggression, of suicidal ideation. And I always want to be careful with this, because one of the things we also talk about in our center is that we have to make sure that students understand that stress is normal, distress is normal. And so in part of like the SEL piece of this is teaching students coping skills and how to manage stress so that it doesn't become something unmanageable. So it doesn't become a crisis, and not every kid is in crisis. So while we see, increases in anxiety or increases in aggression or other behaviors, that doesn't mean we have a crisis, but we do have to respond, right? But I would agree that from what I have seen from some recent studies in terms of the level of risk increasing for students, it has, particularly for kids who were in remote instruction and who came from underserved communities.
And another group that's also, I think, was interesting during the pandemic are kids who do have various reasons where it's difficult for them to be in school, like sort of sensory overload. And so then it seems like in some instances there were like, oh, we can do school differently. So like the pandemic also, this is not me being rah pandemic by any means, but it's like it was a moment where it like allowed for some different approaches to that maybe would not have been, may have been kind of tamped down in the past. I don't know if Lindsey, if that's resonating with you.
I do not have exact numbers on anything in that area. I think that is true. I would say it's true for a very small percentage of students. I think some students, especially those with diagnosed anxiety, enjoyed the online environment in that they didn't have to be in, amongst lots of people and especially, you think about our comprehensive high schools that are quite large and navigating that. And what we know to be true with anxiety is avoidance of the things that make you anxious actually exacerbates anxiety. And so I think in that regard, with some of our students who maybe that was true for them, and so they remained online, that it's actually made it a little bit harder. But for some students, it did provide a different learning opportunity in which they thrived. So there's some positive there as well.
And the interesting thing is it's probably not going away. I mean, we've seen districts across the country, including our own, that now have that as a permanent option.
And are there other examples, like within our district, of things that kind of came out of the last 2 years that you think are now here to stay, that you think are positive? Maybe approaches or centers. I know like the Nest at City High was conceived of before the pandemic. So but is there anything else that was kind of born of that?
I would say just the use of technology in new and different ways. So when we're talking about engagement and opportunities to respond as one of those effective classroom practices, educators were forced to be adaptable and learn new ways of teaching. And some of those things were absolutely for the better and have continued to be used. So I can speak for, again, the elementary school counselors. They learned a lot of different ways to work with students with using technology and have continued to use some of those. They set up virtual counseling rooms that have lots of different resources that are still available. So different ways that people can access information and can connect with people, I think has been really helpful. The other one that comes to mind right away is that telehealth. So we do have some students who have maybe a therapist, but aren't able to see a therapist outside of school hours. And so they do telehealth. They do have their therapy appointments in our buildings just via telehealth. So that's been helped with access quite a bit. So that's been very, very good.
And that reminds me that we are also going to share some resources. So we'll put those on the page on the Obermann Center's website for this event. So I'll collect some of those from our speakers and add those. And I don't know, Allison, do you guys have a resource page on your?
Yeah, if you go to our website, there's lots of stuff, and it's a work in progress, but there are some resources that you can access.
Okay. Well, thank you, all of you, for being here, as well as Bond at the Iowa City Public Library, who's been our DJ tonight, helping us run this in the background. I really appreciate everybody's time, and thank you to those who came out, as one of you mentioned, on a very much a school night to listen and to learn. So we appreciate you being here.